As we age, our bodies often send subtle warning signs that something may be wrong. And sometimes those signs show up in the most unexpected places. After the age of 60, one unusual but important health clue can be found in something as simple as an itchy spot on your body. It might seem harmless, but in some cases, persistent itching can be a red flag for serious underlying health conditions, potentially even affecting your lifespan. If you're over 60 or caring for someone who is, it's crucial to understand what this symptom could mean. Let's dive into the details. Itchy spot. 1. Scalp. Itching in the elderly, a subtle warning sign. As we grow older, changes in the skin become more common, and the scalp is no exception. However, persistent scalp itching in individuals over 60 should not be dismissed as just dryness or a common irritation. In some cases, it can be an early warning sign of more serious health conditions, including dermatologic issues like cutaneous lymphoma or even skin cancers. Cutaneous T-cell lymphoma, for instance, can initially appear as itchy, scaly patches on the skin, including the scalp. These areas may go unnoticed or be mistaken for dandruff or eczema. Similarly, skin cancers like basal cell carcinoma or squamous cell carcinoma can also develop on the scalp, especially in areas with long-term sun exposure. Changes such as lumps, discolored patches, or wounds that don't heal should be taken seriously. Older adults often have thinner skin and may be more prone to skin infections, inflammation, or reactions to medications, which can also contribute to scalp irritation. However, when the itch persists, despite proper hygiene or treatment, it becomes essential to consult a dermatologist. Early diagnosis of scalp-related conditions could make a significant difference in treatment outcomes and possibly even impact overall longevity. Itchy spot. 2. Facial itching in the elderly, more than skin. Deep facial itching in older adults might seem like a minor nuisance, but when the itch is persistent, unexplained, and localized, it could point to something more serious. In individuals over 60, an itchy spot on the face may be a sign of systemic health issues, such as autoimmune disorders or chronic inflammation. These conditions often begin subtly and may present with symptoms that are easily overlooked. Autoimmune diseases like lupus or dermatomyositis can cause facial itching due to inflammation in the skin and underlying tissues. In such cases, the skin may also appear red, swollen, or unusually sensitive. Additionally, older individuals are often prescribed multiple medications, and facial itching could be a side effect or allergic reaction to one of these drugs, especially those affecting the liver, kidneys, or immune system. Itching can also be a response to nerve-related conditions such as trigeminal neuralgia or postherpetic neuralgia, both of which become more common with age. If facial itching is accompanied by other symptoms like burning, tingling, rashes, or swelling, it warrants prompt medical attention. Identifying the cause early is crucial, not only to relieve discomfort, but also to address any underlying health conditions that could affect long-term well-being. Itchy spot. 3. Torso or chest. Itching in the elderly, a hidden warning. An itchy spot on the chest or torso in someone over 60 might seem harmless at first, but persistent or unusual. Itching in this area can be an early indicator of serious underlying conditions, particularly skin malignancies like melanoma or other forms of skin cancer. While itching alone is not always a cause for concern, when it is localized, does not resolve over time, or is accompanied by changes in skin appearance, it deserves closer attention. Melanoma and other skin cancers can initially appear as small, itchy spots, or patches that may change in color, shape, or size. Unlike more common skin issues, these spots may not improve with moisturizers or over-the-counter treatments. Instead, they may become more irritated, scaly, or tender. Older adults, especially those with a history of sun exposure or weakened immune systems, are at greater risk for developing such conditions. In some cases, persistent torso itching could also be linked to internal issues such as liver or kidney problems, which manifest through the skin. That's why it's important not to ignore prolonged itching in the chest or torso area. A thorough skin examination by a healthcare professional could lead to early detection and potentially life-saving treatment. Itchy spot 4, lower back or abdominal. Itching in the elderly, a sign of systemic trouble. Persistent itching in the lower back or abdominal region, particularly in adults over 60, can be more than just a surface-level irritation. While it's easy to attribute such itching to dry skin or irritation from clothing, this symptom can sometimes indicate deeper systemic health concerns, especially involving the liver or kidneys. When the liver or kidneys are not functioning properly, waste products that would normally be filtered out can accumulate in the body, leading to metabolic imbalances. One of the ways these imbalances manifest is through changes in the skin, including increased sensitivity and persistent itching. Liver conditions like cholestasis or hepatitis, for example, often present with generalized or localized itching, including in the abdomen or back. Similarly, kidney disease can lead to a buildup of toxins in the blood, which can cause itching without an obvious rash. This type of itching is often resistant to topical treatments and may intensify at night or after meals. For elderly individuals, especially those with a history of liver or kidney issues, this symptom should prompt medical evaluation. Early detection of organ-related problems can lead to timely treatment and significantly improve both comfort and long-term health outcomes. Itchy spot. 5. Extremity. Itching in the elderly, a sign of circulatory or nerve issues. Localized itching on the arms or legs in older adults can sometimes be more than a minor irritation. In many cases, it's associated with poor circulation or neuropathies, conditions that are increasingly common in the elderly and can significantly affect overall health. As we age, blood flow to the extremities can become restricted due to vascular issues like peripheral vascular disease, PVD, which can cause dry, itchy skin. The lack of proper circulation can also lead to the accumulation of waste products in the tissues, contributing to the sensation of itching. Additionally, conditions like diabetes, which are prevalent among older individuals, can lead to diabetic neuropathy. This condition damages the nerves, particularly in the arms and legs, resulting in tingling, numbness, or itching. Neuropathy may make it difficult for individuals to recognize other serious conditions, like infections or ulcers, which can also cause itching or discomfort. While localized itching on the arms or legs might seem benign, it's important to consider the underlying causes. Persistent itching, especially if accompanied by pain, swelling, or changes in skin color, should prompt a visit to a healthcare professional. Timely diagnosis of circulatory or neuropathic issues can help prevent complications and improve quality of life for the elderly. Conclusion. In conclusion, persistent itching in older adults, whether on the scalp, face, torso, back, or extremities, should never be overlooked. While it may seem like a minor nuisance, it can be a sign of serious underlying health conditions, ranging from skin cancer and autoimmune disorders to liver or kidney disease, poor circulation, or neuropathies. Early detection through proper medical evaluation is key to addressing these issues and improving overall health outcomes. If you or a loved one experiences unexplained or persistent itching, seeking timely medical advice can make a significant difference in managing and treating any potential health concerns.